Psoriasis. What is psoriasis? This is mainly a skin condition marked by patches of thick, red skin covered with silvery scales that occur primarily on your elbows, knees, legs, lower back, scalp and feet. Certainly not life-threatening, the condition can be painful, affect your ability to function, and cause psychological and emotional distress. This dermatitis develops when the ordinary life cycle of skin cells accelerates. Skin cells regularly die and flake off in scales, but in people with psoriasis this process happens within days rather than weeks. Rounded, circumscribed, red, dry, scaly patches of varying sizes characterize the skin. Itching and burning may also be present. On removal of the scaling skin, bleeding points occur known as Auspitz sign. Kobner's phenomenon is also frequently found. This is the appearance of typical psoriatic lesions at the site of an injury. Types of psoriasis. 1. Seborrheic, which is the most common form. 2. Inverse, seen more commonly in overweight people, characterized by smooth patches of red, inflamed skin. Friction and perspiration cause it to worsen. 3. Guttate, which primarily affects people under the age of 30 and is generally caused by a bacterial infection. 4. Pustular, is very common on the feet but overall is rare. It occurs quickly, forming pus-filled blisters which will dry out rapidly but then quickly reappear. When it occurs all over the body, it can produce fever and chills. 5. Erythrodermic, is the least common form, which may be triggered by sunburn or medication. This can cover the whole body with a red peeling rash. 6. Psoriatic arthritis, in addition to the skin reaction, the joints may also be affected in the same way that arthritis affects the joints. Symptoms range from mild to severe. It may lead to permanent deformity but generally speaking is not as severe as other forms of arthritis. The disease is chronic, but you may have periods when the condition becomes worse, alternating with times when it improves or goes into remission. And although no cure exists, treatments may offer significant relief. Factors predisposing you to psoriasis. Aside from a positive family history being a risk factor for psoriatic conditions, other factors include stress, which can have a negative impact on your immune system. Medications, particularly beta blockers, can predispose someone to this condition. Even lithium may make you more prone to pustular eruptions. Excessive exposure to sun can exacerbate the eczema, while small amounts of exposure to the sun may actually help the condition. People with HIV and children with frequent recurring infections may also be more prone to this type of eczema. Treatment of psoriasis. Topical medications for psoriasis. Treatment for psoriasis is geared to reduce inflammation both in skin and bone manifestations. Since statistically most people who suffer from psoriasis suffer primarily skin eruptions, topical medication is usually the treatment of choice. Hydrocortisone cream has always been the old standby. These creams not only cause an immune suppression but they are also anti-inflammatory. Anthralin is a topical prescription medication that when properly used may send your psoriasis into remission for upwards of 6 months. It is messy to use and may stain clothing. Vitamin D analogs may be used alone or in combination with topical cortisone creams. The vitamin D analog helps decrease inflammation and reduce plaque appearance. Coal tar ointments have been used for psoriasis for ages. They are sold over the counter in 1 to 5% strength. They are generally inexpensive but they are also greasy, messy to use, have an odor, and are staining. Tazorac is another medication, which seems to prolong psoriasis remissions. It is particularly helpful when used with moisturizers and ultraviolet light therapy. Keratolytics include urea, salicylic acid and lactic acid creams. These medications help remove excessive scaling. It may be used in conjunction with topical cortisone cream, the idea being that it enhances the penetration of the cortisone cream. But, with greater absorption comes the potential for more complications. These medications may also be used on psoriatic nails in an effort to thin them out. Moisturizers include over-the-counter emollients like Eucerin or Guttate cream or even prescription emollients. They work by restoring the function of the epidermal, skin, barrier, decreasing water loss and improving the appearance of the skin. These emollients are best applied immediately after a bath or shower as they are better absorbed on moist skin. They too may be used in conjunction with topical cortisone cream. Other treatments for psoriasis. Ultraviolet light has been used with success in psoriasis treatment. If you prefer to try some alternative treatments, licorice root and chamomile are herbs that both contain anti-inflammatory compounds. Applied topically to the lesions may reduce the skin inflammation. Aloe cream has been shown to be effective. Since high-protein diets are associated with an increase in inflammation through the body, reducing your consumption of protein-rich foods, primarily meat and dairy products, may reduce flare-ups. Fish oil supplements are also known to have an anti-inflammatory effect on the body and therefore may reduce the inflammation of psoriasis. 4 to 6 capsules a day containing EPA and DHA are recommended. For those with psoriasis, sunbathing can also be helpful. In a world where everyone is avoiding the sun out of fear of developing skin cancer, the sun's rays have been shown to have significant therapeutic benefits. Psoriatic patches are far less common in most individuals during the summer months, so small doses of sun exposure may be helpful. Read the complete article with information of psoriatic arthritis and prescription oral medications which are also available. Go to www.foot-pain-explained.com/psoriasis.html.